If we know how to prevent disease and choose not to, we are participating in harm. That's not anti-medicine, that's bioethics. And once you see it, you can't unsee it. Bioethics exists to answer one question. When is it morally acceptable to intervene in human biology? Most modern bioethics is built on four principles: autonomy, beneficence, non-maleficence, and justice. These principles were designed to protect patients, especially in drug development and clinical care. But here's the issue. They're almost always applied after someone is already sick. In late-stage disease, the ethical calculus is clear. When someone has cancer, autoimmune disease, or acute infection, doing nothing can be more harmful than acting. That's why we debate FDA approval speed, why we weigh benefit versus risk, why informed consent matters so much. And in those contexts, pharmaceutical intervention can be deeply ethical. But that logic quietly breaks when reaction becomes the default model of healthcare. Here's what we almost never ask. What if the harm was preventable? Non-maleficence doesn't just mean don't cause harm. It also means don't allow preventable harm through neglect. Beneficence isn't only heroic rescue, it's creating conditions where extreme intervention isn't necessary in the first place. Yet we normalize decades of metabolic dysfunction, cognitive decline, chronic inflammation, burnout, until medication becomes unavoidable. That's not ethical neutrality, that's delayed accountability. And this isn't just a systems problem, it's a personal one. If you have access to information, resources, and early intervention, letting your biology deteriorate until crisis forces action isn't bad luck, it's a choice. Prevention respects autonomy more. It reduces harm, it's cheaper, more scalable, and more just, especially globally. Waiting until someone is sick enough to justify aggressive treatment is a privilege most of the world doesn't have. This isn't about rejecting pharmaceuticals, it's about using them when they're actually necessary. Ethical medicine doesn't start at diagnosis, it starts upstream, with education, awareness, and early action. Prevention isn't a wellness trend, it's an ethical obligation.